Pregnancy and childbirth have a lot of nutritional, mental, and physical demands on the woman's body. Despite the fact that most pregnancies are actually not planned, having planned pregnancy has been shown to reduce the occurrence of most degenerative genetic disorders, because proper nutrition during the first 1000 days of life, that is basically between conception all through the second year of life, has been shown to have very positive results in reducing genetic disorders, in reducing malnutrition or other problems that might affect children later on in life. All these are small conditions that can be prevented. If you are a woman trying to conceive, or you're planning on trying to conceive in the future, this video is for you, and you can also share with your friends who you know are also trying to conceive. My name is Lilian Momina. I am a clinical nutritionist, and in today's video we're going to talk about some of the things that you can do from a nutritional point of view to prepare yourself and your body better for pregnancy and childbirth and the whole process of motherhood. So without further ado, let's get into the first point, that is ensuring that you balance your hormones. Hormones are very important when you're trying to conceive, and a woman can be predisposed to hormonal imbalances due to different factors. If you have been practicing a bad diet over the years and you want to conceive, it is advisable that you start consuming healthier foods. Take up things like fruits and vegetables, nuts, take up fish, take whole foods like ugali, you can take githeri. Instead of doing those fries, the deep fried foods, you need to substitute with better foods and such. It is important and it will help in balancing your hormones. The second thing that you need to do to prepare for pregnancy is start on iron and folic acid supplementation at least 3 months before you start the conception process. This is because research has shown that deficiency symptoms, that is anemia, in the first few months of pregnancies are usually very detrimental to the cognitive development, and they can cause intrauterine growth retardation of the fetus. You need to make sure that you arrest this before it becomes a problem. So if you're a woman and you've been prone to a lot of bleeding, to a lot of infections, you've been having bad dietary intakes, limiting in terms of iron-rich foods, like if you're vegan, if you are on low protein, then you need to make sure that you start on supplementation. It is very advisable if you want to have a smoother pregnancy, if you want to have a better pregnancy outcome. Anemia has been shown to heighten, it makes the pregnancy problems become more, like you'll get more preeclampsia, fainting spells, you'll get more infections, more nausea. The other nutrients that the demands go high when you're pregnant, usually calcium because of bone formation, magnesium, zinc, they're also important. You can do pregnancy multivitamin. It is very advisable. The next thing that you need to do is be physically active. It is very advisable because it improves blood flow, it improves how your organs are functioning, it helps women have a smoother pregnancy, and also it has been shown to improve and promoting vaginal delivery because it is the natural way of birth. I'm not against C-section, but I'm saying if you can avoid it, why not? It's cheaper, you recover better and faster from vaginal birth than C-section. That's a fact. Don't roast me on that one. The next thing that you need to do is ensure that you tailor your sleep routines well. I know it's easier said than done, but trying as much as you can to have enough rest is very important. The next thing that you need to do when you're trying to conceive is increase your protein intake. If you are consuming low levels of protein, you can increase to moderate. If you are on moderate and you're physically active, you can increase to a high protein intake. Most protein-rich foods are usually very nutrient-dense. By this I mean they have other micronutrients, they have other macronutrients, so they're going to supply you with enough supplies, with better supplies than other types of foods. You're going to make cells for the baby. You need the adequate supply to ensure that things are functioning well, and also after childbirth to help you with wound healing, to help you with breastfeeding, because protein is the nutrient that is tasked with cell renewal, cell division, cell repair. The next thing that you need to do, of course, is have regular sex. Don't have sex when you're ovulating only. It is important to track when you're ovulating or not, but when you start focusing too much on it, you'll be creating a stressful condition for yourself. And we want to avoid stress as much as we can, because stress has been shown to bring a lot of imbalances when it comes to hormones, and this prevent or reduce fertility in women. If you can have sex all through the month, it is also good for your mental health, for your nerves. It will help you relax better. The next thing that you need to do is is have your blood sugars controlled if you are diabetic or if you have insulin resistance. It is very important because having diabetes has been linked to a lot of infertility in both males and females. It is important to put up measures that help with controlling the blood sugars if you are trying to conceive. So one of the things that you can do about controlling your blood sugars is watch this video. I talked about the dietary adjustments of controlling blood sugars, and get a thing or two. The next thing that you need to do is detox your body, taking up antioxidant rich foods, taking up antioxidant rich herbs. You can take up something like glutathione. It's a great antioxidant. It is great with cell renewal, inflammation, and it is going to help your body cleanse up. Antioxidants like Q10, it has been shown to help in improving fertility, helping your body in energy production, how the mitochondria is working. If you are above 35 years and you're trying to conceive, it is advisable that you take up the Q10 supplement. You can also do natural herbs like wheatgrass, chia seeds, flax seeds, green tea, because they are going to provide you with phytonutrients, antioxidants. You can do detox smoothies here and there, but again, we are not going to do crash diets and you're trying to conceive. No, if you have been dieting strictly, like maybe someone who doesn't do carbohydrates, someone who doesn't do fats, someone who doesn't eat, you need to start eating, because you need to nourish your body for this baby. The baby needs a lot of nutrients. If you have not been eating, you need to start eating and taking care of your meals. At least ensure that you consume 3 healthy meals if you're trying to conceive. It is very important. If you are on intermittent fasting, do not do long fast and you want to conceive. No, let's do short fasts. They have been shown to be beneficial, like 14 hours, 16 hours, 18 hours. Don't go days without eating and you're trying to conceive, because you will alter your leptin, you will affect how they are functioning, how the production, you will affect how the hypothalamus is going to release all these hormones. Take care of your hydration. Water, fluid is very, very important. Take care of yourself, and then see a gynecologist if you are having issues with trying to conceive for at least 6 months and you're above 35 years. Book an appointment with your gynecologist, have your fertility reviewed, have your partner's fertility reviewed. You can take up supplements like zinc. You can increase your intake of zinc-rich foods like nuts, eggs, legumes. You can take up meats. All these are going to provide you with adequate supplies. And also, if you are below 35 years and you have been trying to conceive for 12 months, you need to go to your gyna, have fertility tests done, and then take up measures. The next thing that you can do to improve fertility is go get checked and get a prescription on fertility drugs to help you boost your fertility here and there. The next thing that you need to do is watch this video on the postpartum changes that come after childbirth to prepare yourself better mentally, and let's meet there. And give this video a like so that you will be supporting my channel to grow, and it can also be recommended to others. Thanks for watching, and bye.